New this hour, the state Senate just approved a bill that could remove 250,000 people from one of Indiana's Medicaid programs. Let's get to News 8's government reporter Garrett Bergquist now. He's live at the State House. Garrett, what does this bill do, and what's the rationale behind it?
Mr. President, members of the Senate, Senate Bill 351 provides.
This bill is a top priority for Senate Republicans. They've been warning for years that the state's Medicaid program is growing unsustainably. The measure caps enrollment in the Healthy Indiana plan at 500,000. There are more than 700,000 people currently using the plan, so the bill could potentially kick more than 200 people off of the Healthy Indiana plan. It imposes a work requirement for able-bodied adults without children. You would have to work or volunteer at least 20 hours per week if you did not meet one of several exceptions. And it prohibits any advertising for Medicaid services.
Medicaid's grown by $5 billion over the last 4 years. The rate of growth is higher than our entire revenue, our rate of revenue increase. So we're spending more on Medicaid alone than the percentage of our total revenue.
My question is, where's the data that shows that 300,000 people do not need Medicaid services? Wouldn't it be more assuring to all of us to have a report that showed the 300,000 people, maybe 100,000 of them might not need services, maybe 100 of them were not insured before and were not informed before, and they got insured after the expansion?
Mishler says the work requirement alone should bring enrollment below 500,000. He says savings could be used for other purposes, such as paring down the wait list for Medicaid waivers for the Pathways for example, the Pathways program. The bill passed the Senate on party lines. It now goes over to the House. At the State House, I'm Garrett Bergquist for Wish TV, wishtv.com, or follow us on Facebook for updates.